Tuberculosis is a very serious infectious disease, and that was in recent years declining the incidence. However, right now the incidence of TB is increasing globally, and tuberculosis treatment is really truly well developed. However, still many new cases detected every year, and the populations affected are maybe people who already have acquired immunodeficiency syndrome in underdeveloped countries. TB is still one of the major cause of illness, or maybe the major cause of illness as an infectious disease, of death, of illness worldwide. And I think the latest data would reveal from WHO, World Health Organization, that more than 2 million people may die from the disease every year. So how TB is transmitted? TB transmitted by infectious aerosol droplets. Patients will contract TB through the aerosol droplets. However, many people who are exposed to TB will not develop the disease because of the immune system. If you think about it, TB is very old disease. It's been described for centuries. However, it didn't lead to extinction of the human race, but still was affecting certain people. And it called consumption, it's consumed the body of the person. On the other hand, some people would be really healthy while taking care of the patient with TB without using any protective equipment. Or the difference is, again, is functioning immune system, nutritional status, and living condition. So the offending agent in TB is Mycobacterium tuberculosis, and it's a bacillus that still aerobic. It's not an anaerobe, it's an aerobe. And there is some resistance of Mycobacterium TB and to immune system. The bacillus can survive in the dried secretion or sputum, or let's say someone spit on the ground for several weeks. UV light, heating, alcohol, formaldehyde can be destroying the bacillus. And TB certainly can involve not only lungs but other organs like liver, brain, and bone tissue, bone marrow. There was a huge slide about it which I deleted. This is FYI information. TB, some would consider it opportunistic infection because it may become active in someone with, again, weak immune system. So if their immune system is weak, who will be affected? It will affect people with weak immune systems, such as people who have acquired immunodeficiency syndrome, cancer, and or the immunodeficiency is not acquired but induced secondary to, let's say, organ transplant. Bad condition of living, again, poverty, homelessness, drug abuse, all of that increases TB acquisition. TB pathogenesis is has two stages. When you think about it, there is a primary and secondary infections. Primary TB occurs when the bacillus enters the body, and what happens, macrophages will surround, engulf the microbe, and they will cause local inflammation. And regardless on that, some of the bacilli will travel to lymph nodes, and type 4 hypersensitivity reaction will occur, and lymphocytes and macrophages will attack and form a granuloma. And what's a granuloma? It's really like I would say a skin sac, or the correct way really to describe it, it's an epithelial nodule. So the granuloma will contain some bacilli, and some of them will be live. So they will form a tubercle. Tubercle is starting a caseous necrosis, and casein is like cheese, milk related. So tubercles will have inside, in the middle, a stuffing of this cottage cheese like material, which is basically caseous necrosis. And so it will be like a little ball stuffed with it. So immune system will be hindering that development. So even with the TB exposure, the lesions, the little balls, will be still staying small. And the better news, even, they are not only small, but the fibrous tissue will grow around it, and even to make the shield even better, the calcification will occur. So all this described as a gone complex. So this prevents bacilli from jumping out and running around the city and exposing other people. So the bacilli can remain dormant for years and centuries as long as the immune system does well, you know. But let's think if something happened and the immune system is not intact anymore, and then TB will jump into secondary or active phase. So in this phase, TB can break through the gone complex and spread through the lungs to other organs. And this when, again, active TB starts. What happened in this case, in patient will develop cough, and what even worse, hemoptysis. Patient may have night sweats, fever, chills, anorexia, constitutional symptoms such as fatigue, you know, again, anorexia, fevers, and depending where the TB develops, then it will be developing symptoms related to the organs. So diagnostically, Mantle's test, and you all had it because you are in these programs. And if Mantle test is developed and it's positive, then chest x-ray may be performed and sputum culture. So you all been through this reading many times, so I won't be emphasizing it too much. But let's talk about treatment. TB can be successfully treated outpatient, but unfortunate part of it is that the therapy is certainly very long duration. 6 to 9 months, can even take a year, and it's combination therapy of many different drugs, and maybe resistance to antibiotic or antituberculin medication develop. The good news is that if your patient develops TB, the medication will be provided free of charge by public health service, and some states even have laws that the non-compliance with therapy may be considered unlawful and result in putting someone into jail and forcefully making them take TB drugs. But again, prevention of transmission is mostly affects the healthcare providers. TB approved masks, adequate ventilation. Of course, patients should be in negative pressure rooms when they are in the hospitals, and absolutely the contacts, everything has to be monitored by infectious disease service in the hospital. So this is a serious condition, but it's treatable and preventable. And again, the good news is if your immune system is healthy, if you even exposed to the disease, you may not even develop the disease without. And by you may not even develop the disease, you may not have gone complexes, and even if afterwards you are immunocompromised, the disease will not develop. But again, if you are taking care of a patient with TB, and as practicing nurses or nurse educators, you may encounter these conditions, please take personal protective equipment, and please tell the same to your students.